Welcome everyone to what I promise will be an energetic, thought-provoking, and maybe even slightly unconventional conversation. Who am I? I'm Dr. Stephen Klasko. I'm an obstetrician by training. I've been called an optimistic disruptor, and I'm honored to serve as the new board chair of this great company, DocGo, that's rewriting the playbook for how, and most importantly, where care is delivered, which playbook really needs to be rewritten. And today I'm thrilled to be joined by DocGo's CEO. Lee's background is really interesting. Includes work at Google, leading billion-dollar businesses, a finalist on The Apprentice, and he now leads DocGo, as I said, a company that's evolving from a transportation provider to a revolutionary mobile health leader. And everybody's talking about mobile health, but Lee, you're really doing it. And what I'd like to do is really spend some time talking not only about DocGo's vision, but what you're doing today. Maybe get into a little bit of technology and AI's role in this transformation and where the humans and technology get together. And what we might do is take a little Star Trekian trip into 2030 and look back at 2024 and see what we learned from 2024.
Yeah, well, first off, I'm pumped to be doing this. Ever since you joined the company, everyone's saying get these two guys in a room and put the camera on. So I'm just excited we're doing it. Obviously very excited that you're at the company with us. And to me, I mean, healthcare at any address, it was, when we were first chatting about you joining the company, this was one of the big sort of themes that you were talking about. Even before joining DocGo was healthcare at any address. And we had also been on that mission as well. So to us, healthcare at any address means bringing care to where it's needed, when it's needed, no matter the address. It could be a patient's home. It could be a humanitarian site, it could be an office setting, it really could be street side, it could be anywhere that healthcare is needed, wherever it's needed, outside of the traditional doctor's office or hospital setting. And really that whole idea is when you're sick, the place you really want to be is home. And I think COVID really precipitated that. The last place people wanted to be was in a waiting room with other sick people. And certainly if you were there for your checkup or annual wellness visit, you certainly didn't want to be in a waiting room with sick people. And so really, when you're sick, when you're in the hospital, the place you just want to be is home. And to me, that was sort of the big aha moment was if we can deliver care to the home, we would be a tremendous, tremendous help to the healthcare system.
You know, it's fascinating to me, though, the attention to detail of DocGo and ambulance. I'm looking at the cars, and you look at an ambulance with the CE that is screaming in red, and it's sort of interesting that yours is pastel blue, and you know, that to me even sends a signal, doesn't it? That you thought about like what patients would feel comfortable in?
Yeah, I mean, we're intentional with everything we do. And we felt just like the healthcare system was set up, it's emergency, it's a crisis, you're accessing care when you're very sick or when you have to go to the emergency department, and that's just unnerving as a patient. So we felt like, how can we deconstruct the whole thing and make it more comforting, more accessible, more approachable, more relaxing? So obviously that would lead to much better health outcomes. And so for us, we said, let's make our ambulances stand out, let them be sort of this light powder blue, which is way more comforting than the screaming red or the fire engine red ambulances that people think of. And when we pick up our patients, they actually comment to us like, oh, I wasn't expecting it to be sort of this powder blue ambulance. And we've sort of taken that approach. And same thing with the home. We make it more accessible. And we use technology in everything we do. So our ambulances are equipped. We know what's going on inside that ambulance. In many cases, we've redesigned the inside of the ambulance so a family member could sit, let's say, with a bariatric patient. We've really taken the approach where we said, how do we make it more comfortable for the patient, either when they're in the back of our ambulances, as we're taking them to, let's say, to the healthcare facilities that they need to go to, or how do we make it more comfortable for them by getting care in their home, which that's where people want to be. And the only way to put it back the way it was, where the doctor did come to visit you, is to use technology to make it more efficient. And that's where we had this big aha moment that if we could use technology to route all of our vehicles, to make sure that all the patients are seen by the right clinician, with the right licensure, with the right vehicle, with the right diagnostics, all for the right patient need, and manage that whole symphony in the field, we can make it more accessible, more efficient, and then we can put it back the way it was when the doctor used to be able to come to your home with that sort of efficiency.
Yeah, and you were putting AI into your transportation thing before people even put A and I in the same sentence, and we'll get into that.
Yeah, absolutely. Yeah, we've been basically optimizing our routes using our technology stack since the beginning of the company. That was the whole that was the whole kernel of the idea, was if we can use technology to optimize all of the routing so that the ambulances are very efficient in the field, we can see more patients. The more patients we can see, the more people we can help, and obviously the more successful the company would be.
So I'm just curious, and why haven't the Googles or the Amazons really figured this out? They figured it out in every other sector, whether it's shopping or how we do everything else, or even my company, General Catalyst, that invested in Airbnb and Warby Parker. Why has it been so hard? Why did it take you and a company like DocGo to figure that out?
Yeah, well, I think first off, the reason why these technology companies have been successful, and we used to talk about this all the time when I was at Google, is the whole idea is how do you democratize access? So Google, in the case of Google, how do you democratize access to the world's information and make it universally accessible to all, right? Every big tech platform that's been successful has basically taken this one idea, which is there's some portion of the population that has this spectacular experience, right? And so I'll give you, I know you're a DJ, so I'll give you the example, right? When I was growing up, right, your music collection was really sort of a personification of who you were and the access that you had, right? You had a huge record collection, right? You can listen to a wide range of music. You had a small record collection, and that's what you're living with. I remember listening to the same cassettes over and over and over again on my way to camp. I didn't have very many of them, and then the whole idea of Spotify and Apple Music and YouTube is that now everybody that has one of those platforms has every song ever created in their pocket. Doesn't matter where they come from, what walk of life. And that idea now has made these wildly successful companies. And you see it all over the place, from Netflix and Amazon Prime and all of those sort of platforms that give enormous access to everybody, no matter who they are. And so for us, that was the core thesis for the company. And I've shared with you, both my brothers are physicians. And it's not atypical for both of my brothers to come to my house, both of my brothers to come when somebody in my family is not feeling well. And so we don't necessarily have to go to the ER automatically. We don't necessarily have to go to the doctor's office. I mean, it's just the truth. Of course, the kids are getting sick when the doctor's office is closed, right? Of course, someone needs to be seen at 11 o'clock at night. And that's when my brothers come over. And I think that experience, I was lucky to have that. And the whole idea of our company is, how do we give that experience? You don't have to have two brothers that are doctors. How do you give that experience to everyone? And that's really the big aha moment for us. So we go to everyone's home, and we're bringing the same exact experience to every single patient that we go and see, and we use technology basically to do that, just like all the other tech companies that are out there doing it. I think one of the reasons why you don't see some of the big tech companies going into healthcare, or when they try, it doesn't work, is because I think you really do have to fundamentally rethink all of the elements. All the tech companies are trying to take the people out of the delivery in many cases. And for us, we felt like that was fundamentally a very important piece, where you cannot do virtual, you can't do everything virtually. I cannot give you a vaccination through a Zoom call. I cannot necessarily give you your meds through.
Probably can't deliver a baby.
You can't deliver, exactly.
Well, you can deliver it at home, but you need a human.
But the whole idea is you can't digitize everything in healthcare today. And our great idea is that, yes, we do digitize and we do use technology to a great extent, but we also marry that up with the healthcare clinician that is the person that's delivering the care in your home, and they have all of the diagnostics and all technology they need to be effective, but they're still there with you in the home delivering healthcare. And I think all the other tech companies out there are saying, how do we remove the people out of the equation? And for us, we're saying to ourselves, how do we make the people more effective, more efficient, more compassionate, more empathetic, more accessible, and embedding technology into what they do, but they are the central hero in our story.
Yeah, so maybe, it's really how the robots and the humans can work together in the right way. Well, maybe that should be your new tagline, like, DocGo, your brother or sister is a doctor, and, because that is the kind of care that everybody should get. And I think, I want to get into this in a little bit, but that democratization word is more than just a word. And it's so unusual to have a company that literally would, take care of Jeff Bezos's daughter the same way that they take care of, Mrs. Smith, that lives in Queens. That literally everybody gets that level of care, the people, et cetera.
And it's funny you mention that, because that's one of our central tenets of the company. The team hears me say it all the time. the care and the patient experience has to be exactly like we would do for one of my children or for my wife or for one of our loved ones. It has to be exactly the same. It has to be that high level quality. It's expected every patient that we go and see has to be treated with that same level. And we feel that way. That's the democratization that I'm talking about.
I want to get to your business model a little bit because it's sort of at the intersection of innovation and risk, and I think we have to redefine risk.
Right.
Because risk is not, I'm going to go out and drive at 80 miles an hour. Risk is embracing some uncertainty, and there's no more uncertainty than the economics of healthcare.
For me, for our company, the most important thing to me is we only do well if the patients are healthier and doing better and the system is saving money, right? If we made the patients healthier and improved health outcomes, but ultimately it was just costing a ton of money, then that's not good for the system, that's not good for the US healthcare industry, and certainly I don't think we're going to be successful in that way, right? Or of course, if we're not helping the patients improve, then really what are we here to do? So to me, it has to be first and foremost, the patients are loving the services that we're providing, they're getting healthier, we're giving them proactive care, we're keeping them out of the hospital, they're winning. And we're doing it efficiently, so it's costing less money. It's costing the system less money, because everyone knows in this country we have a healthcare, essentially a crisis, where the costs are going up and outcomes are going down. And so we have to save the system money. We have to do it for a lower cost, and the patients have to be doing better. We literally have to reverse the entire, not 360, we have to do a total 180, right, where patients are not getting worse, they're getting better, and the costs are not going up, they're going down. And that has to happen for our company to be successful. And we want to set the whole company up so that if that happens, patients are getting healthier, costs are coming down, we're successful, and not the other way around. So for us, it's all about delivering proactive care. And so really one of our foundational services that we're providing right now is closing care gaps. There are many, there are hundreds, there are millions of patients that have care gaps, right? They need a diabetic retinal exam, they need a bone density scan, they need their meds titrated, they need a depression screen. We do over 30 different care gaps in the home. All of them asked for by our payer partners. They're asking us, say, we have these patients that have gaps in care. They're not going to the traditional healthcare establishment. Perhaps we'll partner up with DocGo and we'll go to their home and meet patients where they are. And we'll close those care gaps. And of course, if we close those care gaps, then we're making sure that patients are healthier before it precipitates into an emergency. And then obviously they'll have better health outcomes, and before it becomes an emergency is usually when it's the cheapest to care for the patient. And the example I love to give, and one of the care gaps that we do is a bone density scan for patients that have osteoporosis, that are at risk of falling and breaking a bone. And the traditional healthcare establishment is trying to drive those patients into the clinic or into a hospital setting or into a brick and mortar establishment to do the bone density scan. And that's great if they're able to do that. There are many patients that have accessibility issues, they can't even go. When we go do that bone density scan at a patient's home, we have a much more insightful view into that patient. Yes, we do the bone density scan, but at the same time, we get a chance to see perhaps there's loose carpeting around their home, and that makes their risk of falling and breaking something way more. Perhaps we see that they have to go up and down the stairs multiple times a day. And we wouldn't have known that they have loose carpeting and they have to go up and down the steps if they just came into our office. But because we go to their home and we get to see a more 360-degree view of the patient, we're able to provide a way more holistic, way more insightful, way deeper level of care that is absolutely going to improve their health outcome. And so to me, that's when the company is winning. We're meeting patients where they are. Yes, we're closing gaps in care, but we're also understanding more of the social determinants of health of our patients so that we can truly impact their health outcome. And so to me, our business model is all predicated on that. And so when we go to the home, we do the bone density scan, we see perhaps that their home environment is not safe, then we can intervene, we can escalate that, we can coordinate care across all the other care providers that they have in their universe, and we can truly improve health outcome. And so if we're able to save that patient from falling and breaking a bone, obviously it's great for the patient, and it's going to save the healthcare system a lot of money, and then as a result, we'll do well. And that's how we want to take risk. I don't want to take risk for a patient that's not inviting us into their home, that we don't have the ability to impact their care, that we don't have that deep insight into what they truly need to stay healthy. But the patients that are inviting us into their home and we're meeting them where they are and we're getting this rich, deep insight into what they absolutely need, then that's a patient that we should and would take risk on because we truly have an opportunity to impact their health outcome. And I think that's the way the whole system should be set up. is that truly that's what value-based care is all about. We have an opportunity to truly impact their health outcome for the better. And so if we do that and we keep patients healthier, the company does well at the same time. And I think that's the way the whole system should be designed.
So I love what you just said, because in some respects that's the holy grail of bringing that all together. And before we get to the future, I just want to talk about the present, because I get a chance to go around to many other countries, and it's frustrating because in some respects I recognize that we have Star Wars technology for individual patients in a Fred Flintstone healthcare delivery system. And that's sort of how people look at us. In my specialty of high-risk obstetrics, we spend 4 or 5 times more per obstetric patient than any country in the world. Because everything happens in a hospital. My daughter got pregnant during COVID, and I remember she went to me, she said, "Dad, I have preeclampsia, I need to get 3 non-stress tests. They have to be at the hospital. My friends in the United Kingdom and others, get it done, closer to home. But I had to spend $35 to park 3 times a week at Jefferson, go to a place and go to an elevator with a lot of sick people, so I could stare at the ceiling and have somebody tell me my baby's okay." And she looked at me, she said, "I thought you were the digital dude, like, can't you take care of that?" Well, we have this problem where hospitals get paid a lot to do it in the hospital. Right. So if you're Jill, that's an inconvenience, but you're going to get that testing. If, let's say, you're a bus driver or an essential worker, or you can't afford a nanny, you're just not going to get the testing.
Right.
And meanwhile, your baby ends up in the NICU. Interestingly, hospitals make a lot of money if babies are in the NICU. That's not what they're happy about, but we have a high NICU rate in this country compared to that. And what you're doing in each of those things is getting that care out to a place where now some people might say, "Hey, I want to get it done at the hospital."
Right.
And you'll provide the transportation to get that done in the hospital if they have the right insurance and that's what they want. But that's not going to be a barrier. So in some respects, you are getting rid of barriers. Think about this of running like track and field, and you've got high hurdles if you're living in an underserved area, whereas if you're not living in an underserved area, you can just run around the track.
Yeah, I mean, how could this be? We have the best technology in the world, and we have decreasing, basically degenerating health outcomes. What is happening here? And I think the whole point is that some people in this country are getting great access to care, like you described, and a huge portion are not. It's funny. I was hitting the phones one day with the team, talking to our patients, and we're scheduling the care gaps, and I'm speaking to them, and I asked a few of them, like, why haven't you gotten this? Why haven't you gotten this colon cancer screening done? Why haven't you gotten some of the care gaps that we're providing, your annual wellness visit, the fluoride treatment for the children? I mean, why haven't you gotten these things done? And universally, either A, they've been trying to get an appointment with their current healthcare provider and haven't been able to get one. B, they actually have mobility issues. They can't go. They want to go, but they can't. And 3, they have childcare issues. Like, yeah, I would go, but who's going to watch my child? Or I need to take this child, but that means I have to take the other one. And I can't coordinate all of that. And so our point is there's a reason why certain populations are not getting the access that they need. It's not because we have this great technology and the system is for whatever reason deciding not to give them care. It's because they cannot access it the way the healthcare system is designed or set up today. So we're changing that, right? If you have a child care issue, we'll come to your home. You could still watch one child while we care for the other. If you have mobility issues, don't worry about it. We're going to come and meet you where you are. If you haven't been able to get an appointment,
and you'll have a customized transportation. We know you have that.
That's right.
So or if you need oxygen, we'll have oxygen in your
exactly. And if you do need to be transported, we'll do that. Right. And so I think that really is the chord that we're striking right now, to use your sort of music and DJ analogy. That's the chord we're striking right now, is that we know that if we go and meet these patients, we can improve their health outcomes, and we're doing it in a different way. Yeah. And so, yes, if a patient is okay, like your daughter, to go to Jefferson and pay for the parking and go, and that's their preferred location of care, and it's working for them, great. There's a huge percentage of the population that they can't, like you said, they can't access it in that way, and that's the need we're there to fill.
Yeah, in my DJ world, I'm thinking of the song "Man in the Mirror." I'm looking at the man in the mirror. I'm asking him to change his ways, and nothing could have been much clearer. If you want to make the world to change, start changing yourself. And in some respects, what happens in healthcare a lot is everybody blames everybody else, and you're basically saying, let's just solve the problem. So All right, I want to do a little science fiction-y because
Okay.
I've written a few science fiction books. I like to live in a science fiction world because it seems like they're usually, other than the apocalyptic ones, they're usually better worlds, and you can do anything in science fiction world, right? So, and I don't think, I don't like the moonshot metaphor for healthcare because I think that just makes it too simple. We're not going to solve cancer with the moonshot. But what I'd like to do is look ahead. I created a video where I'm now the Chief Digital Health Officer for President Taylor Swift because the Swifties have become a party. And our healthcare motto is make it tailored to the individual, make it swift, neither of which is quite true in 2024. So think about what either AI or technology innovation that you could start, if you could wave a magic wand beyond what you're doing today, that would really completely redefine healthcare delivery, with what you're doing today with DocGo. Under this guise of DocGo is no longer a transportation company, no longer even a mobile healthcare delivery company. It's really a healthcare delivery company that's doing everything that's not bone marrow transplants and things that have to be in the hospital or not, the payer piece that the payers are doing, not creating drugs, but everything other than that, you're taking care of.
Yeah, I mean, I'm glad you asked this question because, we live at DocGo, we live in the real world. Like, we're out seeing patients. We're not in Silicon Valley making some technology. We're seeing patients and we're creating what the field and what the industry and what our patients and what all of our partners are telling us they need. And to me, I think there's two things that AI, if I fast forward, let's say 10 years, and the future's coming very, very fast, and you talk about this all the time. One is, we'd like to use AI to predict the future, what the patient is going to need before they need it. Right, so if we can look at all the past patient history and compare that and base that based on all the millions of patients that fit a similar profile and predict that they're going to need some intervention 5 months down the road, or God forbid they're going to have a major health catastrophe 5 months down the road, predict today what we can do today to basically avert that and sort of predict the future for this patient and then work our way back and give them the care they need now so they have a different outcome.
So theoretically, not theoretically, practically, you would move population health, social determinants, predictive analytics from this philosophic and academic, this is what we ought to do, to literally the mainstream of clinical care and payment models, because this is what you're doing.
Yeah.
You would know what's going on with that patient at home. You would understand what she needs. You would understand, what she's had in the past, what's worked in the past, what hasn't worked in the past. You would know if she's taking her medicines or not taking her medicine, because her pill box would be that if she does steps, and you would put that into your algorithm as to what she best needs, along with your hospital or payer partner.
Yeah, so really that the first idea I have is that in the future we know this patient's going to have a heart attack or a stroke or some really catastrophic health event. It's going to happen in 5 months from now. We can predict it based on the patient's previous past history and essentially the care they're getting today. And what can we do today to make sure that event doesn't happen 5 months from the future? And using all the predictive analytics that we have, everything that AI can tell us about this particular patient as it relates to all the other patients that fit a similar profile and have a similar chronic condition, and then predict what the patient's going to need in 5 months from now, but act today on that. That's the first thing. The second thing I think is, I want to get to a world where a patient no longer needs a second opinion. When we show up at the patient's house, that first opinion is based on AI and all of the different, wisdom of the crowds and wisdom of all of the physicians that basically are informing what that patient specifically needs, so that they don't need a second opinion. We can do what's needed right then and there. I get the example I always give. I have 4 children. My son was told at month 10 he needs glasses. Right? Pediatrician does a eye exam and says, we think that your son needs glasses. 10 months old, he can't read from the board, he doesn't know the alphabet yet. I mean, how do you know that he needs glasses? They have this great technology, we're very, very appreciative of it. Great. We take him to a pediatric ophthalmologist, and the pediatric ophthalmologist says, yeah, your son needs glasses. My wife and I are looking at each other, this is a big decision, right? He's just looking at our son's eyes, he's dilating. Does he really need glasses? God forbid we give him glasses, he doesn't need it. Let's go get a second opinion. We go to a second pediatric ophthalmologist. That doctor says, no, he doesn't need glasses. He doesn't need glasses. Leave him for now without the glasses. So now we're sitting here like the first pediatric ophthalmologist says he needs. The second says he doesn't. Now what? Okay, take him to a third one. third pediatric ophthalmologist. The third one says, yeah, he does need glasses, right? So now we're thinking, okay, 2 says he does, 1 says he doesn't, right? And we have the ability to take him to all these specialists to really make sure he's getting the care he needs. And so we basically crowdsourced all the top pediatric ophthalmologists in the New York area, and 2 to 1 says he needs it. I think in the future, if we can get to, and by the way, a lot of patients are seeking a second opinion, and 71% of the time, the second opinion is giving a different treatment plan. So the second opinion is often different than the first opinion. I think if we can democratize access to that second opinion, except the second opinion is not a second opinion, it's a million opinions that are happening from all the crowdsourcing of all of the physicians and all the diagnosis that AI can give, I think that would be an incredible word. So we get the first opinion absolutely accurate and right the first time. And as a provider and as our teams are going out and caring, if we can know with certainty this is indeed what the patient needs, and we can predict what they're going to need based on the prediction of what we're making is going to happen in the future, and we can give that treatment plan right then and there without thinking through, but we know with certainty this is what the patient needs, and really crowdsourcing the second, third, and millionth opinion, I think that would be an enormous efficiency that the healthcare systems can have. And I don't hear anyone talking really about that.
Right. Well, it's interesting because you're right. I mean, we tend to look at things in healthcare often black and white, right? So I was chair of the advisory board for IBM Watson, and it was, okay, AI will take over radiologists, pathologists, and most doctors. Well, that was their commercials, and they believed their commercials, and they got sold for parts in 2022.
Right.
That was 2013, back when
Right.
when I was doing that, because healthcare is not quite beating somebody in jeopardy, right? I think this whole issue of how I kid around because it took us about 40 years to get doctors and nurses to talk to each other and work together and not feel one was on top of the other. I think we have to do the same thing between doctors and AI.
Right.
Is how do the robots and the humans work together? And I think even something like radiology. I was giving you a personal example. I had a 1.5 centimeter mass in my lung, and had a great radiologist who found it. But at the end of the day, they were ready to do a pretty massive procedure. There's a company, a GC invested company called AI Doc, that basically doesn't try to replace a radiologist. What it basically says is radiologists are amazing, and the best ones are right 96% of the time.
Right.
The not so best ones are probably less than 96% of the time. We want to fill in the other 4 to 10%.
Right.
And by the way, we want to learn. So we want to send it back to the radiologist and say, hey, I think you missed this. And the radiologist might go, no, you're crazy, AI doc. And then I'll learn, I'll be better.
Right.
So in my situation, I had that mass, and I had several years before at another institution, an abdominal CAT scan. It turns out that mass was there, but not what the human had looked at, because they were looking at an abdominal CAT scan, but it went up a little bit to the lung. And AI doc said, hey, radiologist, I'm not sure if you noticed this, but that abdominal CAT scan had the exact same size, and it was several years ago. So it probably can't be what you think it is, because there's no chance it would have been the same size.
Right.
That changed the procedure. And that's a really good example, because the doctor at USF didn't do anything wrong. He was looking at the abdominal CAT scan.
Right.
The doctor at Jefferson was looking at a new 1.5 centimeter mass. AI doc was able to put it all together and say, hey, maybe you should look at it differently. So to me, that's where it sort of comes
Great,
together, in the best of all worlds. I want to spend a minute though talking about AI in a different world of workforce transformation. Like the thing I get most excited about is conversational AI, and I think it's got a way to go. But there's companies like Hippocratic AI and Ellipsis Health. Ellipsis started off as a mental health company, being able to tell based on just talking to you, not even what you're saying, but on the tenor of your voice, that your anxiety or depression has gotten worse. And now it's gotten to the point where it can look at your people that are providing care and say, this person's getting to the patient, or the patient's responding, this person isn't. Again, not by what they're saying, but just the tenor of voice. Hippocratic AI has created Rachel, the AI nurse. The empathy is so good that patients have gone into the office and said, hey, I want to see Rachel. She's so much nicer than the nurses in your office.
Right.
So how do you see that potentially fitting into AI, into DocGo in a way that is expanding and helping the human part, but not replacing even part of what you do?
Yeah, I think so. First off, obviously, we're making enormous amounts of phone calls and engagement with our patients on a daily basis, right? Today we monitor over 50,000 cardiac implantable device patients today, and we're calling them oftentimes to make sure that we're getting the proper readings. And I think during those conversations, if we can glean additional insight just by the biomarkers of their voice, right? Perhaps they're having a precipitating cardiac condition. Being able to do that, not just by what they're saying, but how they're saying it, across the tens of thousands of cardiac patients, let's say today, that we're monitoring, and more obviously in the future, I think that would be a tremendous, right? We still have our clinicians calling the patient, but now they're just armed with more information, more insight into the patient's condition. I think that's going to be phenomenal for patients, and it's going to obviously make us a lot more efficient, and give us the ability to really provide much more holistic care to the patients. I also think, look, in some cases, if we can automate portions of the process, we can, again, further drive the cost down, increase access to more patients. You know, I always talk about, as a company, we have to put our own oxygen mask on first, and then once we have our oxygen mask on first, we're healthy, our company is doing well, we can help a lot more people and help put the oxygen mask on them. To me, the more efficient we can get as a company, and using AI perhaps to do patient engagement, patient outreach, patient navigation, have Rachel perhaps calling some of the patients and coordinating care, leaving our clinicians to do the higher order, higher level stuff, I think that will allow us to serve even more patients, be more efficient, and that's, again, the whole ethos of the company.
Two more brief questions. So, you know, I'm a DJ, and I live my whole world around music, and I actually wrote a book called Feeling All Right, How the Message in the Music Can Make Healthcare Healthier. You know, and it was basically taking 50 songs in a Spotify playlist that will define the new healthcare. So, first chapter was Courage to Change, which I think you'd agree with, by Sia. Yep. Second chapter was Keep the Customer Satisfied, which I think you'd agree with, by Simon and Garfunkel. So if you were going to create a DocGo playlist that captures the company's energy and mission, just give me a few songs that would be on it and why.
To me, so I'm a big Hamilton fan,
okay.
and the musical and Lin-Manuel Miranda and everything. When I listen to that musical, I feel like they're describing the company. And so the first song to me that comes to mind from there is Nonstop. And the whole song about, you know, Hamilton, he's just nonstop. Why do you keep writing like you're running out of time, like you're running out of time? And we have a culture like that. I think any great leader feels like, you know, I feel like it's nonstop. Why is it nonstop? Because we're racing to this future, and we just have to keep going.
And you're
nonstop,
unstoppable.
and we're just unstoppable, and we're not going to sit by and let it pass us. We're just going to be relentless, and I think the whole company has that culture, and I think as a leader, that's something that I'm really trying, you know, just nonstop. Why, Lee, are you going like you're running out of time? Because we are running out of time. Every patient that we can see, that we can get to, is another patient that we can help. Right. You know, we talk about it. We have this. Our payer partners have given us hundreds of thousands of patients. Right. Some of them want to give us more. And I say to the team, and I say to our investors, first, let's make sure that we're seeing the patients that they've already entrusted to us, and then we'll take on more. And we keep building this capacity. It's just nonstop because we want to keep going and going. Because the more we go, the more we can, you know, the additional patient we can see.
And that's the two things I learned yesterday. One was the more.
Right.
It's like we're doing this more, and the second, which I think is such a great culture, yes, we will.
Yep.
You know, when somebody asks us, "Can you do this?" Yes, we will. It just brings back, you know, when and you know, my team knows this. When I was the dean and CEO at University of South Florida, we went to see the Speaker of the House, Marco Rubio, and I had a script of what I was supposed to ask for, which was just really, really, really boring. And my president said, "Just make sure you stick to the script because we can't be there. Don't go out of that script." You know, and I looked at the script, and it was going to be like, "Oh, we want more money for this," and you know. So I looked at the script, and it had been a whole day at the legislature. And I just said to myself, I can't do this. So I ripped it up, and I said, "Speaker Rubio, you know, like I'm supposed to ask you something. I'm going to get in big trouble because I'm not. But I'm sure you've had like lots of people you've talked to today. Like, what are you interested in?" And he smiled, and he said, "You know, I've spoken with 30 people today. Nobody's asked me that question." And he went into this whole thing of, you know, I happened to be at my kid's soccer game and somebody got hurt, and you know, there wasn't a doctor or a healthcare person around, and I found out Florida's like number 48 out of 50 in having, you know, high school and grade school sort of, you know, sports health things. Are you doing anything with that? I said, "Yes, we are."
Right.
I had no idea. And I went back to our head of physical therapy, our DPT program, and I said, are we doing this? And he goes, I don't think. I said, yes, we are. And within 48 hours, we had a program that brought in $6 million a year, still brings in $6 million a USF around being one of the leaders around sports health. Last question, real brief. I love to think 2030 from behind. 2030, we're celebrating DocGo's amazing investor and healthcare success, fundamentally changed the way people access healthcare. What's the one headline you'd love to see about DocGo in the Wall Street Journal when they're talking about us?
Yeah, I think everyone thinks like the headline as a CEO of a public company has to be, you know, we have the most patients, we have the most revenue. To me, the headline has to be that we saved someone's life. That's the headline. And then we did it times millions. To me, that's the whole headline. We helped intervene, or we provided proactive care, or we basically identified that a patient was going to have a catastrophic event, and we intervened, we saved their life. And not only did we save their life, we did it times millions of other patients.
So the headline would be, DocGo saved a life 1,000,000 times through healthcare at any address.
Exactly.
How's that?
I love it. Let's
All
print
right.
it.
So this has been an incredible conversation. I want to thank you, from DocGo's evolution and leadership in technology and humans to a DocGo playlist. Thanks for sharing your vision for what I think is a really optimistic future of a world where healthcare meets patients where they are. And to our listeners, remember, healthcare doesn't have to be what it is today. It doesn't have to be reactive. It doesn't have to be expensive. It doesn't have to be inconvenient. And I think with companies like DocGo leading the way, and hopefully we'll see more, we'd like to have more competitors in this space actually, we can move toward a future where everyone has access to high quality proactive care wherever they are, as if their brother or sister was a doctor. So with that, we're signing off. We might not totally agree on the music. I'm not as big a Hamilton fan. You're probably not as big a Sia fan, but we're in complete harmony when it comes to transforming healthcare for the better, even though we come from very different worlds. So thank you all for listening, and please stay tuned under DCGO for what comes next, because the future is bright and DocGo's leading the charge. Thanks, Lee.
Thank you.